Hi everyone, and welcome to this week's live video tutorial and Q&A. So this week I really want to talk about back pain and injury. So my name is Linnea and I have been a personal trainer and Pilates instructor for nearly 2 decades now. Before that I was a semi-professional circus performer and coach. And so I've worked with a lot of people that have some kind of back pain, oftentimes caused from a specific injury or episode, and also sometimes just kind of from chronic, aches and pains or, long hours sitting at a desk or something like that. So today I really want to get into, some things that I wish I would have known when I started coaching people. And also I have personally recovered from a herniated disc in my neck that really caused me a lot of pain and took me a long time to figure out what was going on with it. So I am hoping to save y'all some of the struggles that I went through and hopefully make your process a little bit easier to get out of pain. Maybe you know somebody that's struggling with back pain. Okay, so I think and obviously before we really get started, this is no replacement for consulting a medical professional and, actually having a specific assessment of your unique body and history and needs. So this does not replace actual medical advice for your specific condition. Okay, so I think before we really, one of the first places to start is to really talk about what are the causes of back pain. And, back pain is ubiquitous. Pretty much almost every adult will struggle with some kind of back pain in their entire life, but there's lots of, there's a really big difference between, having one episode of back pain that lasts for a couple weeks and then kind of is gone, maybe just from some stiff muscles, versus having something a little bit more serious going on. Okay, so back pain can be caused from poor posture, repetitive poor posture where you're just kind of stuck in a bad posture for hours and hours and hours and days and days and days, and you don't really ever change out of that bad posture. It can be caused by repetitive use, like if you always twist in one direction and you just do that over and over and over again. It can be caused by, scoliosis in an extreme form, but also in, we tend to think of scoliosis as these big, huge curves in the spine, but also kind of small little curves in the spine we could also think of as a scoliotic type of curve, or basically just any kind of misalignments or curves in the spine can certainly contribute to some kind of back or neck pain. And then we also have acute injuries, right? So I want to touch on those a little bit today. Certainly, if you get in a car accident or you have a bad fall or potentially a concussion or something like that where you have a large impact that's affecting your spine, that can certainly contribute to some back pain. So it's essential to identify what you think is contributing to your back pain so that you can, follow the appropriate pathway to finding some relief. So maybe I'll start with a story about my neck pain. So I was a semi-professional aerial circus performer for almost 10 years. And this was back in about 2007, I guess, something around there. I was training with a friend and we were on a trapeze. She was on the ground, I was on the trapeze, of course, practicing this move called a meat hook, right? So the name kind of says it all, but I heard this snap in my neck. She could hear it. She was on the ground. She was probably 5, 6, 7 feet away from me or something like that, and she heard it. And at the time, I was just a little stunned, but not necessarily immediately in excruciating pain or anything like that. And it wasn't until later that evening that I was turning to pick something up and my neck just totally went out. And then I was in excruciating pain. I could barely move. and what did I do next, right? Like, that's an interesting question. Like, you have some episode, like, so let's say you have some acute episode, and all of a sudden, like, you really did something to your neck or to your back or your spine somewhere. What do you do next? And I think for a lot of people, or at least what I did, is I went to the chiropractor, right? And actually the chiropractor helped a lot. And I kind of thought that that was enough, and continued to have some neck pain after that. It did kind of help a lot to go to the chiropractor. Continued to have some recurring pain, quite significant after that. And then as I had some other injuries stack up on that, specifically after I tore my ACL in my knee and I was on crutches for 3 months and went through this extensive rehab process with that. And then as I was trying to get back into kind of peak athletic shape and start performing again as a circus performer after I rehabbed from my knee injury, that is actually when my neck pain really flared up. Like, it just came back so bad. And I think, the story I tell myself that makes sense to me is that I had, still this kind of residual kind of weakness and imbalance in my neck. And then I went through this other significant injury that kind of further pulled my body out of whack. And so then when I kind of went to go back to a full level of training, I just couldn't withstand that much. I couldn't withstand that much training or that much load. So let's break it down, okay? So that happened to me, and it took me actually almost 8 years to get an MRI, okay? And an MRI is a type of imaging that will show you what's going on in your spine. Okay, so I had to go to the doctor and I had to request that there was something more going on. I had to go be like, look, this isn't going away. I need some imaging here. So I think that this is quite common for people, that you maybe experience an injury and then go to the chiropractor, maybe get some body work, call it good, kind of story ends there. And even if you really go to like your doctor and your primary care doctor and you get a referral, like oftentimes they will not refer imaging, which maybe is fine. I'm not saying anything's necessarily bad here, but in my own personal experience, it took me 8 years to get imaging to find out that I had a herniated disc. Okay. So that would have been great information to know earlier. And so I want to take a pause here for a moment and just describe in super simple to understand terms, like, what is a herniated disc? That's a super common, more acute spinal back injury. And then I also want to talk a little bit about what a spinal stenosis is. And those are two pretty common, but like a little bit more serious back injuries that, if you're having some signs and symptoms of these kinds of injuries, then you just want to know that and know to kind of like maybe ask for imaging or just proceed with caution, or, maybe don't just like go to the massage therapist and then call it good, especially if you continue to have pain for years following. Okay, so a herniated disc, the easiest way to describe what that is to think of a jelly donut, right? So you've got a donut and it's filled with jelly on the inside. And if you squish the donut, then the jelly is going to scooch out from the other side, right? It's pretty simple to understand that image. Okay, so what happens in our spine, right? We have 26 vertebra, right? And between each vertebra in our spine, there's a little bit of padding between each bone, right? And in that padding is kind of the jelly donut. So you've got bone, jelly donut, right? And so when there's an injury to our spine, it squishes out that jelly filling from our proverbial donut, right? And that pushes into a bunch of nerves and can cause a lot of mayhem and a lot of discomfort, okay? So that's kind of a good image to, I think, have, is like that jelly donut, right? And, I'm not a doctor. I'm not diagnosing anything here. It's just information for you to have. And if there's a herniated disc, it will often cause a lot of nerve pain, right? Like significant nerve pain, significant pain all over, but specifically nerve pain that might like go down your leg, go down your thigh, go down the back of your butt, potentially even all the way down into the calf or the foot. So that's kind of the classic red flag, especially if it's going all the way down into your calf or your foot, is like, ooh, definitely you want to put some more attention into that. That's not something to ignore, right? Okay, so then let's also talk about a spinal stenosis. So a spinal stenosis is similar in that it can have an impact on how well the nerves can flow through the spinal cord, right? So if a herniated disc is causing kind of the jelly filling to push into your nerves, and it kind of gives less space for your nerves to move, right? We want to have like lots of room for the nerves to move, but if all of a sudden there's like not as much room in those joint openings, then that's going to cause some discomfort. So that could be happening because of that disc and the jelly donut kind of squishing, or it can be happening from spinal stenosis. So if we go back to our kind of like bone, disc, bone, or bone, donut analogy, right? A stenosis, I mean, there can be lots of variations. So stenosis is kind of a broad general term, but let's just say a stenosis might be caused a little bit more when the bones actually shift, and it's the bone moving that's in one way or another. Sometimes it's like the way that the shape of the bone changes, right? But it's gonna close that available space for the nerves to get through. So the jelly might still be in the proverbial donut, but the joint spacing where the nerves can flow through still is getting shortened, and it's getting compressed, and there's not as much room for the nerves to flow and groove and move. Okay, so again, it's going to show up as a lot of nerve pain, a lot of significant pain in general, but often a lot of nerve pain specifically. Okay. Hi, Kristen. So great to see you. We're talking about back pain and we're talking about injuries. Also, I just want to shout out to everybody. This is a tutorial and a Q&A, so feel free to throw in some questions, whether they relate to you or maybe a client that you have. We're talking all about it, okay? So I just kind of briefly described a herniated disc and a spinal stenosis, and kind of told my own story of how it took me 8 years to get some imaging to find out what was really going on with my neck and to actually get that imaged. So it's interesting because it's like I saw a million, like maybe not actually a million, but I saw a handful, like at least 5 or 6 different chiropractors, at least 5 or 6 different body workers, if not more. You know, I was deeply involved in the yoga community. I was pretty deeply involved in the Pilates community, seeking, you know, private instruction. I don't want to blame anybody, but it's just interesting that like with all of these different movement professionals and medical professionals, like nobody, and even physical therapy, like nobody said, oh, you should go get that imaged. So I guess maybe that's why I am now on a little bit of a journey, a little bit of a mission to be like, if you've got significant pain, like you need to get that imaged, or that might be a really good idea. It happened with a colleague recently. She was really struggling with a lot of pain and she came to me. She was also seeing a number of other chiropractors and body workers and a few other, you know, movement professionals. And she came to me, and I didn't even do that many sessions with her, but I was like immediately just like, this is a case where you want to go get imaged. Like, to me, it just seemed like, yeah, that's probably a herniated disc. And I didn't really want to do a whole lot more unless I knew if it was a herniated disc. Like in a perfect world, I know if somebody's coming to me, I want to know if they have a herniated disc or not, you know, like I don't want to assume that. So anyway, I encouraged her to get some imaging, and lo and behold, she had a couple herniated discs in her back. And like a few weeks, maybe 4 weeks later or something like that, she was really in debilitating pain, like could hardly walk and was crawling on the floor just to make herself coffee in the morning. So, you know, for her, it actually was a great scenario, even though that was totally a terrible experience. At least by the time she was in that excruciating pain and crawling around on the floor because she literally couldn't even stand up and walk, she already knew that she had herniated discs. She already was taking the right measures to find relief, and she already knew what was going on. So, I mean, wouldn't that be better than just all of a sudden not being able to walk, not being able to stand up, and you just have no idea what's going on? So Kristen's asking, what did you do differently once you got the imaging? Oh my gosh, that's such a great question. Okay, because this actually leads really well into something I want to talk about, which could be useful even if you've just got like sort of some stiff muscles, right? So you've got some stiff muscles, it could actually be causing some nerve pain, right? Like you might have some significant back pain even if it's not a super massive serious injury. So it can be a little hard to navigate, and it's like, what do you do differently? What do you do? Just glancing at my notes here to make sure I'm not missing anything. So let's make this a little fun, right? Because this can be kind of a downer topic, right? We can get really scared, especially as as practitioners. We can get scared for our clients. As the person experiencing the pain, we can get really freaked out and scared for the health of our own body, understandably, right? So let's use two kind of fun imagery examples, right? So let's use the example of a supermodel walk, right? Somebody on the catwalk and they're walking like they've got their supermodel walk. And then we're also going to use the image of a bikini line, right? So you've got your bikini on, it's the summertime, you're at the beach, and you've got your bikini. So what are you going to do differently if someone's got a herniated disc? Well, this is interesting, Kristen, because it's like, well, am I talking to the practitioners in the room, or am I talking to the folks that are experiencing the back pain? Because it's going to be a little bit different, the language that I use, right? There's a whole slew of contraindications. For example, if somebody's got a herniated disc. So, from a practitioner point of view, if somebody comes to me and I know that they have a herniated disc, I'm going to be going a lot slower with any kind of flexion. Somebody that's got just a stiff back, and I can kind of tell like, oh, they don't have a whole lot of back pain. They don't have a lot of nerve pain. They don't have nerve pain going down their legs. They don't have any kind of, medical diagnosis. I would maybe do a bridge where I'm asking them to really flex their spine and lift their hips. Like that's a pretty common Pilates move to do a bridge where you lift your hips up and articulate through your spine and add some spinal flexion as you go into a bridge. I mean, there's a ton of different Pilates movements that require that, that you would certainly do with a beginning student, right? You could easily have a beginning student with back pain and be asking them to go into spinal flexion. If I know somebody's got herniated discs, I'm not going to be doing that. I'm not going to do that for a long time, probably. Or if I am doing anything like that, I'm doing it with a lot of clear intention and a lot of like before and after assessing and things like that. Yeah, exactly. So neck pain, so I struggled with chronic neck pain as well. And then 8 years later found out it was from a herniated disc. So this all applies, right? And especially when you get up to the neck, it's interesting because, and I'm getting back to the supermodel walk thing. So like, this is where it's going to be fun. So I'm going to segue now into some sort of really super practical tips and tricks, right? So 10 years chronic neck pain. And what did I do? I would go to the chiropractor. The chiropractor would, give me a lacrosse ball and be like, oh, use the lacrosse ball and dig into it and different things like, oh, stretch. Like basically I was tugging and yanking and pushing my neck around in an attempt to make it feel better. But like, it wasn't actually helping a lot. I mean, sometimes it would help a little, but it was certainly not giving me any kind of long-term resolution. And there I was just like kind of messing around with my neck a lot. But it's a neck, like we want to be careful, right? It's a spine. We want to be careful. We don't want to just like bug it and poke and prod at it, right? So hopefully what I'm going to segue into now will give you a few other ways that you can approach your body and your posture, even as kind of a lay person that's maybe not trained to know the contraindications of dealing with a herniated disc, okay? So I'm gonna point my screen down just a little bit. Hopefully my phone doesn't go flying off this stand. Okay, so let's think about your pelvis, okay? This applies to neck pain, but also specifically a little bit more like low back pain. Okay, so a supermodel hike, right, would be like, I call it a supermodel hike or a supermodel walk, right? It's when your pelvis is going to go up on one side and up on the other, right? So it's sort of like this would be your supermodel walk, right? And functionally, when we just walk around in our day, we want to actually be able to have a little bit of this functional supermodel hike as we walk around, okay? So that's what I'm talking about, is kind of in the pelvis and the low back. Like, actually, it's kind of perfect that I've got this zipper, because the zipper is kind of showing what the spine does, right? So in a perfect world, when we're just relaxed, ideally the spine is somewhat straight. But let's say you live with a supermodel hike up on the left side, right? So let's say that this is your posture, right? And you can actually see the zipper, right? The zipper is no longer straight. It's got this little bit of a curve to it, right? So this is something that you can see with your clients. This is something that you can actually just assess for yourself, looking in a mirror. Like, it's also crazy that it took me so long to just understand these basic things for myself. Like, I would go to the chiropractor and I kind of knew there was like a twist or a torsion or something going on in my hips and pelvis, but like, I was so confused. I didn't really understand what it was, right? So this is a way for you to kind of get a little bit more empowered of just understanding what's going on with your own body. So do you have a supermodel hike on one side more than the other, right? You can karate chop your hands at the top of your waist and push down, and you might like notice that one hip's a little higher than the other, okay? So what is that gonna mean? Let's say that you've got one hip that's higher than the other. You can look at the curve of the zipper, right? And you can see that this side of the zipper is a little bit longer, like my shirt is longer on that side, and this side it's a little bit shorter, okay? So even though your pain could potentially be over on this side, you would want to stretch this side. Does that make sense? Because this side is more compressed and shortened. So if you're going to stretch it, it's going to lengthen it out. So your pain does not necessarily tell you exactly what needs to be stretched, right? You might be having pain because this side is always getting pulled apart. And you might understandably kind of think maybe, oh, I need to stretch that side, but then that would stretch it out even longer, right? So we don't want to do that, right? So you can assess for yourself your own supermodel hike, and whichever side is higher, you might have a side that's higher, you might not, right? Whichever side is higher, you would want to stretch out that side. You might want to do a little bit of a stretch on your back on that side, all right? You get the idea, okay? So that's what we're talking about in terms of stretching kind of this zone of your back, okay? Now let's talk about the bikini line right here. It's interesting because actually if I have a hike up on this side, then this bikini line is going to be a little bit shortened, and this bikini line is going to be a little bit opened, right? So you can see, and you can do this for yourself, just looking in a mirror, like looking down, you can see if you've got one bikini line that tends to live a little bit more like closed and compressed, and one bikini line that tends to live a little bit more open, okay? So you'd want to stretch the one that's closed. So even though I might be stretching this side of the low back, I would actually want to stretch this side inner thigh and potentially the opposite hip. Okay, so that is a quick and easy little thing that you can do for yourself if you've got back pain, low back pain. It happens for the neck as well, right? So I tend to go like this if I exaggerate, right? And so you can see this side of the neck is shortened and this side of the neck is lengthened. Right? So, I mean, lo and behold, my neck pain is on the right side, and I would usually try to stretch out that side of my neck. Okay? But then what happens if it doesn't actually stretch out, right? So like I would do this and I would stretch, but, you know, one thing that's interesting is nobody ever encouraged me to kind of do that and have that my own self-awareness around it. So I thought, you know, once I started to learn about these things, it was actually really obvious to me when I looked in the mirror. I could see that I was kind of like this. I'm exaggerating a little bit. But nobody had ever, you know, I was spending lots of money going to these movement professionals, chiropractors, physical therapists. Nobody had ever been like, hey, can you tell that this side of your neck is shorter than this side? So had somebody encouraged me to do that and notice that and have that self-awareness, maybe I could have looked in the mirror for a second and then stretched out the right side of my neck and then say like, oh, did that help? And if that helped, then that's a good exercise for me. But if I stretch out the right side of my neck and I'm still just like this and I'm still having the same amount of pain, then do I want to keep doing that stretch on my neck? Or then are we in this, you know, territory where we're just poking and prodding? I hope you see what I mean, right? if my pain is all in my neck and I'm here, but then I also notice that I am having like, a really shortened, compressed bikini line on one side and one side's really open. What if I try stretching out this bikini line right here, and then all of a sudden my neck lengthens on that side? Well, then that would be a better stretch for me to do than just poking and prodding on my neck. Okay, so let's summarize here, my friend. I'm gonna try to push the screen back up. We'll see if that works. Okay, so let's summarize. If you're experiencing back pain, or maybe you know somebody who is, maybe it's a close relative or friend, it's not something to be ignored. Okay, it's not always a tight muscle. It might be something more significant. You don't want to ignore that, and you may want to seek real imaging, okay? As a practitioner, as a movement professional, if you have clients that are experiencing significant nerve pain, especially if it's going down past their knees, you might want to suggest to them that they seek medical advice and get some real imaging, get an MRI if they can. A lot of times you have to advocate for that. I don't know why, at least in the States, a lot of times they don't just recommend it. It's expensive. So you kind of have to like be the squeaky wheel and really ask for it. Be curious, right? Maybe it is a tight muscle. So also don't get too freaked out, right? How can you use the information that I just presented to become a little bit more curious and a little bit more self-aware about how your body is just resting in space? Do you have a supermodel hike on one side? Do you have a bikini line that's a little bit more compressed on one side than the other? Right? So how can you start to become a little bit more self-aware about what your body is doing in space and use that information in order to be a little bit more intelligent about how you stretch or how you strengthen, or even how you take that information to a chiropractor or something like that. You might just sort of notice, oh, I've got that supermodel hike on one side. I'm going to tell that to my chiropractor when I go in today, right? And then the chiropractor might be able to, that might be really helpful for them. The chiropractor might be able to be like, oh yeah, I see that. Thanks for pointing that out. And I can see that when you're standing up on your feet versus when you're laying down on the table. And it might help them kind of give you a beneficial stretch or an exercise. Okay, so I hope that was helpful. I love sharing this knowledge. I want everyone to be able to get out of pain and get out of pain faster and more efficiently and not live with 8 to 10 years of chronic back pain. And so once again, my name is Linnea. You can find me at Limber Arts online, social media, Instagram. LimberArts.com is my website. And I will see you guys next week. Share this with somebody who you think needs to know this, and also drop a comment below, drop your favorite emoji. I'd love to just kind of know your key takeaway or how you feel right now after watching this. So a thumbs up, an emoji. Feel free to ask a question in the comments below, and show up live if you want to mark your calendars. I'm here every Wednesday around 11 a.m. Pacific time. And I also send out a post on Mondays giving the topic. So you can look for the post on Mondays and throw your questions in there, and then I'll answer it real time. So Kristen, I hope that was helpful for you. I love that you were asking questions. Feel free to ask me more. Maybe the next time I'll talk a little bit more specifically about neck pain, because it is its own beast as well. So, okay, thanks everyone. Till next time.